Pennsylvania Senator John Fetterman is back on the Hill after his treatment for clinical depression. Fetterman tells People magazine he was, quote, firmly indifferent to living, and his tough Senate race made his mental health worse. The 53-year-old Democrat describes his big debate against Republican opponent Mehmet Oz as something of a turning point. Listen to this. He says, quote, "I'll never forget the date. It was October 25th. I knew I was going into this debate that millions of people were going to be watching, and it wasn't even just for Pennsylvanians watching. This would be kind of national. It would be living history. But I was still in recovery from the stroke. It would be trying to run a marathon with a broken ankle." Joining us now is Dr. Jeff Gardier. He's a clinical and forensic psychologist and professor of osteopathic medicine. Dr. Gardier, thank you so much for being with us this afternoon. You would imagine that winning such a big Senate race would be one of the happiest, proudest moments of someone's life, but that's just not how depression works, right?
Exactly. And what happens with depression is it completely changes your outlook. So anything that is extremely positive now becomes negative. And what we're seeing with Senator Fetterman is that there is a link between that stroke that he had and possibly with depression. We see that depression occurs after a stroke in 1 in 3 patients. So what we're seeing here is the possibility that the stroke may have caused a depression or deepened a depression that may have been there because of the neurotransmitters, because of dying tissue in the brain from the stroke, or also that there is a depression that comes in finding out that you are now on a road to recovery, but it is an extremely long road, Boris.
So in layman's terms, what happens when someone has a stroke that changes their brain that might trigger a depression?
Well, what we see is there's something called an infarct. And what that is dying tissue of the brain because the vessels of the brain are not getting enough blood. What is theorized that may have happened was an atrial fibrillation that the senator may have caused some sort of an infarct in the heart or an occlusion of blood in the heart, and it traveled up to the brain and therefore caused this sort of problem. And what this may have caused is what we called some sort of a receptive and expressive aphasia. In other words, a sort of a brain damage where the person has difficulties processing and producing speech. The good news is through many months, sometimes years of getting treatment. For some people, it's much quicker than that. For him, it looks like it's going to take a little bit longer, that many people do recover.
That is great to hear, Doctor. I'm curious about the kind of treatment that he could receive and how the challenges of serving in Congress might impact that treatment.
Well, I am really disheartened to see how many of the political trolls are looking at every misstep because of not fully being back emotionally and physically from this stroke, from his depression. And that's absolutely the wrong message that we're sending. We need to be, if nothing else, promoting individuals who come back from something like this and really praising them. But to your exact question, what we tend to see is they need to get more speech and language therapy, which I'm sure he's getting, physical and occupational therapy, as well as counseling, mental health support, and of course, for his depression, psychotherapy as well as medications are very helpful.
Yeah, some of that criticism on social media is just uncalled for and does nothing to relieve the stigma that there is oftentimes around mental health. Dr. Jeff Gardier, we very much appreciate your expertise. Thank you so much.